Hi, I'm Jemima Chukwu, a GESEP intern under the specialty of embryology and reproductive counseling. Today, I'll be discussing Colles fracture on this tutorial video we've been asked to prepare. If we recall from our anatomy, the bones of the forearm include the ulna, that is this bone, and the radius bone, which articulates with the bones of the wrist. This articulation or this joint helps in movement of the hand. Colles fracture is named after Abraham Colles, an Irish surgeon who first described this fracture in 1814. Colles fracture is the most common type of radial fracture. It is a complete fracture of the distal part of the radius bone. Distal part is here as I am marking. It is not this place, which is the proximal part, but this place, the distal part. Colles fracture is due to a fall on an outstretched hand, which is dorsally flexed. This is an outstretched hand, dorsally flexed, up, facing, looking upwards. It's like dorsally flexed. Assuming the fall happened this way, outstretched and down, it is termed ventral flexion. This one we will not call it Colles fracture but Smith fracture. But our concern for today is Colles fracture, which means outstretched hand and dorsally flexed. The clinical presentation of Colles fracture is frequently described as a dinner fork deformity, resembling the curvature of a dinner fork, as you can see on this photo. The fracture causes a posterior displacement of the distal fragment. This distal fragment causing the forearm to be angled posteriorly. It's very obvious this curve you see is as a result of this fracture of this bone, the radius bone. And gently checking, I forgot to say, gently checking on the ability of the fingers to abduct and adduct on each interphalangeal joint are also done to also assess the Colles fracture. The types of Colles fracture could be open fracture if the bone broke through your skin, comminuted fracture if the bone broke into more than two pieces, intra-articular fracture if the bone broke into your wrist joint, extra-articular fracture if your joint isn't affected at all. Some authorities like Gustav Frankman identify different forms of this fracture based on the extra and intra-articular nature of fractures involving the distal ends of the radius and the ulna. He classified this into type 1 to type 8. Looking at the diagram I have here, type 1, type 3, type 5, type 7 are similar, whereas type 2, 4, 6, and 8 are also similar. The difference is type 2, 4, 6, and 8 is like type 1, 3, 5, and 7. But the difference is the ulnar styloid process, which is fractured in this aspect. You can see them on all of that of the type 4, type 6, and type 8. The ulnar styloid process is also fractured. In the type 1, type 1 process, right, at the type 1 part of the type of Colles fracture, it involves the fracture of the Colles and the Smith. The type 3 involves the radiocarpal joint, whereas type 5 involves the radioulnar joint. Then type 7 is now a combination of both the radiocarpal and the radioulnar joints. What are the signs and symptoms of Colles fracture? The signs and symptoms of Colles fracture includes pain. This injury is very painful. One may not be able to hold or grip anything if diagnosed or presented with Colles fracture. Another symptom is swelling, another numbness, another tenderness. Tenderness is now like the pain felt when the affected area is touched. Another symptom is bruising. Possible complications include shortening of the radius bone, this radius bone here. There's also another complication, stiffness of the wrist and the forearm. And another complication is ulnar styloid process may be broken off. Remember that process, which I will circle here, it may be broken off. And when it's broken off, it's a complication already outside the radius, which is going to be fractured. Rarely do we see carpal tunnel syndrome, but it's considered as a complication of Colles fracture. Middle-aged women, adults, and elderly persons that may have low muscle mass and inadequate intake of calcium and vitamin D are at risk of this Colles fracture. Osteoporosis is also a risk factor of this fracture. It could be primary or secondary. The primary is most common as the most common form associated with aging and postmenopausal state in women, and this is where we are really concerned with. But in children, the fracture may extend through the distal epiphyseal plate, which is indicated here. If you look carefully, that's the distal epiphyseal plate. If that fracture extends to that aspect, it will lead to a misalignment of the plates with the radius, and it's a risk factor already on its own. The diagnostic methods involves plain radiography. Plain radiography is like a way to confirm the diagnosis of Colles fracture. Another is physiotherapy. Physiotherapy is advised, especially because the aim is to restore the function and the strength of the fractured wrist. This could be done by intrinsic hand muscle exercise. Now, coming over to the treatment of Colles fracture. The aim of treating this fracture is obviously to return the wrist to its former or prior place of function. Notice that treatment depends on the type of Colles fracture, the patient's age, the patient's desire too, because some may be scared to carry out the surgery or medical the surgery. Then another another thing to in which the treatment depends on is the surgeon's preference. The treatment modalities may include casting and or surgery. Prevention of Colles fracture. Colles fracture should be prevented if we are well nourished, if we eat good food containing calcium and vitamin D, which I have highlighted in my previous teaching. Exercise is also a way to prevent Colles fracture. If we exercise, what does it do? It helps strengthen your bones and muscles. Finally, a way to prevent Colles fracture is by guiding your wrist. If you are involved in sport activities or regular activities that may raise your risk of getting Colles fracture, it is advised to wear a wrist guard to protect your wrist if you fall. Because should you fall, we don't pray for that, but if you fall and you're not with a wrist guard, you are likely going to come out with a Colles fracture. So it's advised you wear a wrist guard if your job or your duty is so demanding towards your wrist or so. I have spoken at length, and I believe I have exposed and enlightened you on Colles fracture. Stay safe and be well.